famous Russian scientist Mednikov was the first to discover probiotics and described the probiotics as good bacteria that kept you alive and was capable of replacing dangerous bacteria in the intestine, keeping the human alive and the intestine intact. And he proposed that the right probiotics could expand life and make you younger. The total number of bacteria in our intestine is similar to 2 or 3 kilograms. And that's a lot, meaning that we have 10 in the 12th bacteria per gram. And it's billions of bacteria in the intestine, and all the bacteria plays a role in our ingestion. The bacteria in the intestine make sure that we can digest what we eat. We can have vitamins produced by and absorbed by the right composition of bacteria in the intestine. So we can conclude today that probiotics have many beneficial effects on the human nature. We can avoid diarrhea, we can reduce episodes of diarrhea, we can diminish allergic symptoms, we can enhance the absorption from the intestine of vitamins, proteins and other essential productions from the intestine. We can reuse bile acid to save energy from the liver products, and also the irritable bowel symptoms that some patients suffer from can be very much reduced by probiotics. Patients having bloatings and pain in the stomach can be helped by probiotics, and that has also been shown from a very large study. We started a study to screen a lot of lactobacillus species to find which of these 47 strains that we examined had the best beneficial effect on almost everything going on in the intestine: the adhesion to the epithelium, the production of vitamins and fatty acids. And by doing that in the lab, we picked out 2 species of lactobacillus, Lactobacillus rhamnosus and Lactobacillus reuteri, which had almost all the beneficial effects on the intestine, and they grew well, and it was able to refine the bacteria after giving it to patients for after 10 days. We could culture the same bacteria that we fed. The strains was discovered about in the middle of the 80s, and from there on we started to examine the possible positive effects from these strains. They were cultured from children, normal healthy children, and after we have found the positive effects and had our benchmark done, we picked out these 2 strains because they were best at all to examine. So all in all, as a conclusion, you can say that the combination of our normal bacterial microflora with probiotics is beneficial for the digestive system. We can avoid virus infections if we give it prophylactic. We can shorten lengths of stay in hospital if we treat actively the patients with diarrhea. We know that from other studies that the immune system is enhanced by using probiotics. We know also that some pathogenic bacteria is not able of doing their effect if we give probiotics. We can altogether say that probiotic is very beneficial in many situations, from diarrhea to allergy, even respiratory diseases, urinary tract diseases, infections is benefited by probiotics, and that has been shown in several studies as well. If you combined all the bifidobacterium and lactobacillus, you may hit all that has the same symptoms as IBD but different causes. So the more you combine, I think the better it is.